And what is given to the nerve gas casualty? Atropine, how many milligrams each syringe? 2 milligrams in each syringe. If a person is exposed to a nerve agent and it's a vapor, what's the first symptom? Pinpoint pupils. And if it is the liquid on the skin, muscle jerking and twitching. Remember, they're going to have pinpoint pupils, tightness in the chest, muscle jerking and twitching, and salivation. They'll be drooling and slobbering. Non-medical people can give 3 syrettes or 6 milligrams of atropine. Medical people would give atropine every 5 to 10 minutes until what appeared? Signs of atropinization. Signs of atropinization are the mouth dries up and the person develops tachycardia. Once the nerve gas casualty has gotten medical aid, what drug is used as an adjunct to atropine? 2-PAM chloride. Remember, the nerve agents in the book are GA is taboon, GB is sarin, and GD is soman. And the only nerve agent used by the United States is VX. No name, just VX. Next, B is for blood. A blood agent is also known as a systemic poison. A blood agent interferes with oxygen supply to the brain and the vital organs. You need a drug that's used for immediate vasodilation. You need amyl nitrite. You would crush 2 ampules, place under the mask, repeat every few minutes until you use a max of 8 ampules. Remember, the person's going to die quick or they're going to get well quick. Once the blood gas casualty has gotten the medical aid, what drug is used as an adjunct to amyl nitrite? Sodium thiosulfate IV. Remember, the 2 blood agents listed in the book, AC is hydrocyanic acid. Hydrocyanic acid smells like almond. CK is cyanogen chloride. Next, C is for choking, not chemical. A choking agent is also known as a lung irritant. Remember, if a person is exposed to a choking agent or lung irritant, they died, they're referred to as a dry land drowning. Remember, a person exposed to a choking agent or lung irritant, there is no specific treatment. The only thing you can do is treat them symptomatically when you get them to medical aid. No specific treatment. Choking agents listed in the book, CG is phosgene smells like new mowed hay or freshly cut grass. CL is chlorine was first used in Ypres, Belgium, WW1, 1915. How many casualties? 5,000. And the United States had how many casualties due to chemical agents during the First World War? 1/3. Next. Blister agents, also known as avescent. If a person is exposed to mustard, which is designated as HD, or nitrogen mustard, which is designated as HN, remember, the symptoms are delayed. They don't appear normally for 12 hours, but might be delayed up to 24 hours. What's normally the first sign? Reddening of the skin. And remember that once redness appears, decontamination is useless. And remember, if the eyes are affected, they're going to have a gritty feeling in the eyes like they got sand in the eyes. Whereas if they are exposed to the other blister agent, which is lewisite, they're going to have what? Pain on contact. Somebody that's exposed to lewisite might even need morphine. What are you going to give the lewisite casualty? BAL, which is British anti-lewisite, which is also known as dimercaprol. And what would you use in the eyes of the lewisite casualty after 24 hours? 30% sodium sulfacetamide. And remember the other blister agent that's listed in the book. CX is phosgene oxime. And what are you going to use to treat it? Sodium bicarbonate dressings to treat phosgene oxime. Remember that those 4 are used primarily to kill. The next 3 are used primarily for training and ride control. Next, a vomiting agent is also known as a sternutator. If a person is exposed to a vomiting agent and sternutator, how are you going to help you get rid of the symptoms? Vigorous work and exercise will help you get rid of the symptoms. The vomiting agents listed in the book, DM is atom site. The other 2 are DA and DC. You can pronounce them just as well as I can. Next, tear agent, also known as a lacrimator. 2 tear agents. CS is more potent than CN. Remember, if somebody is exposed to a tear agent and they have the liquid on the skin or on the mask, if they face the wind will evaporate it. And if they have chest discomfort, it can be relieved by talking. And the last one is psychochemical, also known as a hallucinogen, a drug that screws your mind up, alters body thoughts. The only standard psychochemical agent used by the United States is BZ, also known as 3-quin. There is no specific therapy. Remember, somebody exposed to a psychochemical agent, the only thing you can do for them is keep them from hurting themselves or anybody else, put them in a padded cell, put them in a straitjacket. But remember, the drug that's used after 4 hours is physiostigmine. What type of burst creates more burn casualties? An air burst. What type of burst creates more burns of the eyes? A night air burst. The shock wave accompanying an underwater burst will produce mechanical injuries. What type of clothing gives you the best protection? Loose-fitting, light-colored wool. Remember, the best place to be is in the basement of a reinforced concrete building next to a wall. It's caught out in the open, drop to a prone position, cover your mouth and nose. No, Phil. Captain came over to see me this morning, so he might have complained. Now then, lost all train of thought. What type of radiation is the most penetrating? Gamma rays. What type of radiation does the most damage it gets in the body? Remember, alpha can be stopped by a piece of paper, but if it gets in the body through a cut or through respiration, it does the most damage. What's the minimum number of decon stations on a ship? 2. Remember, at the decon station, you got to have metal cans with tight fitting lids. Lifespan results how long after nuclear attack? 20 to 30 minutes. When you go to the decon station, where do you go first? You go to the monitoring station. They check you to see if you are contaminated. If you are contaminated, not wounded, you would go directly to the decontamination station. If you are wounded, you would first go to the emergency treatment station, and you would be decontaminated. Remember, if somebody is wounded, somebody that has traumatic injuries, you have to have somebody with OR experience to help decontaminate the person, but they can't decontaminate themselves. What's the most common microscope used in the lab? Compound microscope that controls the amount of light that reaches a condenser. The eye of diaphragm. What is the youngest form of neutrophil? A metamylocyte, also known as a juvenile. Progresses from there to a band, which is what shape? S or horseshoe shape. And a band is also called a stab. Progresses from there to a segmented, which is 4 parts, to hypersegmented, which is 6 or more parts. What's another name for a neutrophil? A phagocyte. So you guys ain't never going to forget that, man. When you do a gram stain, what's the first ingredient? The crystal violet. What's not recommended because of the cotton purity? Gentian violet or methyl violet is not recommended. You could use crystal violet or ammonium oxalate solution. You put it on, how long do you let it on? 1 minute. What does it do? It colors everything in the slide. Blue, black, or purple. You let it on for 1 minute, you flush it with tap water. What's the second ingredient? The Graham's iodine is also known as what? The mordant. What does it do? It fixes a crystal violet to all gram-positive organisms. You let it on for how long? 1 minute, you flush it with tap water, and then you would use 95% acetone alcohol, which is also known as the decolorizer. Remember, you would tilt the slide, you take a dropper bottle, and you would squirt it on there until the purple color stopped running, usually 20 to 30 seconds. And it's washing everything off the slide except the gram positive. And what's the last ingredient? The saffron is also known as what? The counter stain. And its saffron colors all gram-negative organisms pink. Remember, gram-positive dark blue or purple, gram-negative is pink. How long do you let the saffron on? 30 seconds to 1 minute. Remember, 1 minute, 1 minute, 20, 30 seconds, and 30 seconds to 1 minute. That is a difference. Remember, a smear is positive for gonorrhea is reported as enter an extracellular gram-negative diplococcus morphologically resembling Neisseria gonorrhea. Causative agent is Neisseria gonorrhea. What's normal WBC? 4 to 11,000. What's the term that's used to denote a WBC below 4,000? Leukopenia, a few conditions. Typhoid fever, hepatitis, and anaphylactic shock. What is the term that's used to denote a WBC above 11,000? Leukocytosis, a few conditions. Appendicitis, pneumonia, meningitis, emotional upset during labor. Now these are just a few of them. There's other ones that's in the book too. So when you get it on a test and one of those is not there, don't say, no, she didn't tell me that. What is the term that's used to denote a WBC above 100,000? Leukemia. Leukemia is above 100,000. What is normal RBC? That's right, you better ask me that, in a man. 5.4 million plus or minus 0.8 million. In a woman, 4.8 million plus or minus 0.6 million. In a newborn, 5.1 million plus or minus 0.9 million. Remember, the RBC in a woman is lower than it is in a man. How about hematocrit in a man? 42 to 50%. In a woman, 40 to 48%. What's the most convenient means for determining specific gravity? The urometer should not touch the sides of the container as read where? At the bottom of the meniscus. But if the urometer is not on here, they got a thing that looks like a telescope. That is an index refractometer. What's known as specific gravity? Remember, 15 to 30, 1.015 to 1.030. Pale urine with a high specific gravity is due to the presence of sugar. If cast are present in large amounts, the urine is always positive for albumin. And what test would you use in a lab for determining albumin? The sulfosalicylic acid test, and what would indicate albuminuria? A white turbidity. Cast in urine indicate what? A kidney disorder. Am I going too fast for some of you guys? You want me to slow it down? Huh? Because I get on a roll. I'm going. What is the largest of all normal WBCs? A monocyte, what WBC increases allergic and parasitic conditions? An eosinophil. I already covered a neutrophil, didn't I? What's the rule for counting the cells when you're doing a blood count? You count the cells that touch the lines on the top and the left, but you don't count the ones that touch the lines on the bottom and the right. You don't count the backward L. How many fields do you count for doing a WBC? You count 4 fields, you multiply by 50. How many fields you count when you're doing an RBC? 5 fields, you multiply by 10,000. If the cells vary by how many? If they vary by 20 cells from the field containing the fewest to the field containing the most, you have an inaccurate count, and you got to do it again. When you collect a 24-hour urine, have the person come in at 8 o'clock in the morning, urinate, and throw it away. You save it from that time until the following morning at 8 o'clock, and urinate and save it. What's normal range? 800, 2,000 cc's. Range, average, 1,500. What is the best urine preservative? Toluene is the best. Why? Because it seldom dissolves to produce false positives for albumin. And which one sometimes dissolves to produce false positives? Thymol. Remember that if you collect a urine sample and you're not going to examine it under a microscope right away, you should put it in the refrigerator. And remember, if you use a urine preservative, when you pipette below the urine preservative. When you do a CBC, you're determining the number of red and white cells and how much blood. 1 cubic millimeter. When you do an RBC count, the RBC pipette is a red pellet. You would draw the blood up to 0.5 mark, and then what solution would you use? 0.85% normal saline, which is sodium chloride. You draw it up to the 101 mark. How long do you shake it? 3 minutes, not in the direction of the long axis. When you do a WBC pipette has a white pellet. You draw the blood up to 0.5 mark, and then what would you use? Either acetic or hydrochloric acid. You would draw up to the 11 mark. Again, you would shake it for 3 minutes, not in a direction long axis. They used to ask it all the time, if you drew it beyond the 101 mark or the 11 mark, how do you get rid of the excess? And the answer they want was touch the tip of your finger, but they don't play that no more. So I don't know what they'd ask. I guess when they come out with a new book, we'll find out. Touch the tip of your glove? I don't know. Remember what I put on the board yesterday? PMTM. What's T? Did I put it on for somebody else? Well, I'll put it on for you now. Huh? See, that's the thing. You see, the people 137 got the same class history, but I do one thing for one person. You guys run the recorders ought to know. When you think of this, think of a bug chaser. We didn't finish the lab, did we? That's why. Okay, that's why. We better get the lab. Let's finish the lab up. Hell, we got all that first aid and emergency procedures, and I'm sitting here running my mouth. Since I gave you all the answers to the questions, a WBC whose cytoplasm contains numerous coarse, reddish-brown granules which are lighter than the nucleus is a eosinophil. Remember that. An eosinophil is reddish-brown or orange. Which are below normal values, the leukocytes is not correct. Stagnated is 51 to 67%. Not working? Huh? me the hook. Oh, damn. Back together. White stain must be stored in a stopper bottle in a dark place for a minimum of 30 days. What's white stain used for? Differential. You count how many cells. You count 100 cells. What's the least solid specimen in urine? Random. They may ask you what must always be reported in a microscopic exam of urine. RBCs or erythrocytes? Always. What's the normal WBC in urine? 0 to 3. Anything more than 3 indicates a urinary tract infection. What's the normal specific gravity of urine during a 24-hour period? 15 to 30, 1.015 to 1.030. Remember, specific gravity is the highest in the morning. Also know, when you're talking about acetic acid is a WBC diluting factor for WBC, acetic or hydrochloric acid. If you added 1 drop of 5% acetic acid to urine, a urine specimen, it ruptures the red cells and it makes the white cells stand out. It makes them more refractory. What indicates albuminuria when you're testing with the sulfosalicylic acid method? A white turbidity. When calcium present in large amounts of urine is always positive for albumin. And remember that calcium in urine indicate a kidney disorder. The additional 1 drop of 5% acetic acid in urine sediment will have what effect on the urine sample? It disintegrates the red cells and makes the white cells stand out. It makes them more refractory. Pathogens that reproduce best at 15 to 20 degrees centigrade is termed cyclophilic. That's where the PMT comes in. Remember a bug chaser when you're talking about these. Cyclophilic reproduce best at 15 to 20 degrees centigrade. Mesophilic is 20 to 45 degrees centigrade. Thermophilic is 50 to 55 degrees centigrade. And microaerophilic is pathogens that reproduce best in reduced amounts of oxygen. What type of bacteria is spherical, appearing singly in pairs, chains, clusters, or packets? Cocci. Remember that spirilla is spiral-shaped, corkscrew-shaped, or coma-shaped. They appear singly only. Which of the following bacteria is present in an individual with tetanus? Gram-positive bacilli. Gram-negative cocci is gonorrhea, meningitis. Gram-positive is pneumonia, strep throat, impetigo, boils, furuncles. There's a group of them. Know about mononucleosis. A lot of times they'll ask on a test when symptoms are demonstrated. Know that infectious mononucleosis antibodies may be demonstrated as early as the 4th day of illness, but practically always by the 21st day. That's on there a lot. After the RPR antigen is prepared, how long is it good for if it's kept in the refrigerator? 3 months. And if it is not refrigerated, it is good for 1 month. Which of the following is not true concerning RPR card tests for syphilis? That's right. No agglutination is observed. The full 5 minutes should be used. Know that when you do an RPR, if it's non-reactive, it'll have a gray color. And know that if it is reactive, you have to do an FTA-AFB. Now, I've seen them ask it on a test where they had things about syphilis and they didn't want none of those answers. Another test they use for syphilis is Darkfield's. Darkfield's exam used for syphilis. What's the incubation period for syphilis? 10 to 10. 10 days to 10 weeks. What's the causative agent? Treponema pallidum, which is a spirochete. What is the incubation period for gonorrhea? 2 to 9 days. And the causative agent is Neisseria gonorrhea. The potassium hydroxide KOH preparation test is used in the lab for the identification of fungi. An individual who has neither anti-A or anti-B antibodies would be placed in what blood group? AB. Neither. Okay, a rule as far as blood grouping goes, the rule that they go by is Landsteiner's rule. That was on an exam here not long ago. What is the most important Rh factor? D, factor D. What percent of the population is Rh positive? 85. Negative is, I hope. An individual who has anti-A antibodies and the presence of the Rh agglutination would have what type of blood? B positive. For a complete list of all laboratory forms, you should consult the manual of the medical department in chapter 23. And what is the manual of the medical department? What form number? It's a NABMED P117. This below is not matched correctly with the microscope, objective lens, color code, and total magnification. He is right. A is low power, B is high dry, and D is oil immersion. What did I tell you about objectives on the microscope? What do you use for detailed study of staining bacteria? Oil immersion. How about a WBC? What did I tell you about the WBC? Remember, the WBC is thousands. It is lower than the RBC. Low power for the WBC, high dry for the RBC. Okay, I'm going to read you something. Whenever I revise this damn thing, I'll probably put this question in. Blood grouping is accomplished by comparing the effects of the agglutination by the antibodies on the corresponding antigens within the red cells. The Rolex formation, and take a Rolex watch, is another phenomenon that causes trouble in blood typing. It's caused by blood sera with high globin content and appear as red cells stack up like a pile of coins. Rolex formation can easily be confused with true agglutination, and that is on there all the time. If urine is red, brown, or smoky, what's it due to the presence of? Blood. If it's yellow or brown, it turns green with yellow foam when you shake it, bile. If it's olive green to brown black, phenol. If it has a milky appearance, chyle, C-H-Y-L-E. If it's dark orange, pyridium. Treatment with pyridium. And if it's blue-green, it's due to the presence of methylene blue. Now get out your emergency procedures. A type hernia is treated by not exerting any pressure on a mass, and opiates will be given for pain. An incarcerated hernia. Remember that a reducible hernia would be evident when the person was standing, but most of the time when he lays down, it disappears. Know that a hiatal hernia is a portion of the stomach passes through the hiatus. An inguinal hernia is a portion of the bowel, or a protrusion of a portion of the bowel through the inguinal ring in the scrotal sac. And remember, if a person has an incarcerated or strangulated hernia, it is a dire medical emergency, and you got to get rid of the person as soon as possible. If a person has an inguinal hernia, you should put them in a shock position and apply moist heat. What is not recommended in the treatment of acute thoracic emergencies? You don't use sedatives to depress the respiratory center. What type of severe pneumonia has a 60% mortality rate? Aspiration pneumonia. What else has a 60% mortality rate? Botulism has a 60% mortality rate. Know that if a person has pneumococcal pneumonia, you should treat them with penicillin G, 600,000 units every 12 hours. And if they're allergic to penicillin, you would give them tetracycline or erythromycin. Know that pneumococcal pneumonia is the cause of 60 to 80% of all primary bacterial pneumonias. When you think of a person who has a particular grunt heard on expiration, think pneumococcal pneumonia and pleurisy. But the symptoms for somebody that has pneumococcal pneumonia is a fever 100 to 105, pulse rate as high as 160, increased respiration 30 to 40 a minute, and a particular grunt may be heard on expiration because it hurts. The same way with pleurisy, the person is going to have a particular grunt. These other symptoms aren't there, but they will have the grunt. What conditions characterized by dry, scratchy throat, hoarse, husky voice, fever, a cough that produces a mucopurulent sputum, musical rhonchi, and wheezing? Acute bronchitis, and note that the most serious complication from bronchitis is pneumonia. A lot of times on the first choice, asthma, they'll ask you what is caused by a reversible airway obstruction, asthma. They may ask you what's the drug of choice, epinephrine, also known as adrenaline. They may ask you how you would relieve the pain if a person had pleurisy. And the answer they want is to strap the chest. They don't do that no more, but they still ask it on the test. I remember when I was at Quantico in 59, how guys come bruised ribs, we'd tape them up. We don't do that no more. But if they have it on the test, how you relieve pain and pleurisy, you strap the chest. What condition is usually the result of left ventricular failure, microstenosis, but may be caused by drugs, aerating gases, or burns? Pulmonary edema. Remember that pneumothorax is air entering the pleural space. Decompression sickness is air bubbles in the bloodstream. Remember, if a person has decompression sickness, they're going to have joint pain. They'll have neurological symptoms. Which of the below is not true concerning a peptic ulcer? That's right. Frequent feedings of bland food and milk is no longer an accepted practice. What condition is treated with bed rest in a semifallous position, kept MTL in an ice bag placed on the abdomen? Appendicitis. Remember, a person has appendicitis, they would have pain in the right lower quadrant with rebound tenderness. Remember also the WBC would be above 11,000 most of the time. Know about that fourth choice, a regional enteritis. It's most often seen in young adults. What type of hepatitis is usually transmitted by fecal-oral route and occurs periodically or in epidemics? Infectious hepatitis. Know that B is serum hepatitis, caused by razor, toothbrush, or drug paraphernalia. And there's also an alcoholic hepatitis. What's pyrosis? That ain't bad breath either. Pyrosis is heartburn. What condition requires surgery is more common in women? B, cholelithiasis. It's also known as gallstones. Know that symptoms for cholecystitis usually follow a large fatty meal. Another question they may ask you concerning pancreatitis. Know that it occurs in 40% alcoholics, 40% is caused by biliary disease, and 20% from a variety of causes. The patient reported to sick bay with excruciating intermediate pain that originates in the flank or the kidney area and radiates across the abdomen and along the course of the ureters, they would be suspected of having renal calculi. Remember that if a person has renal calculi, what would you not give them? Antispasmodics. If a person had epididymitis, you would use a scrotal bridge or pillow. Provide a sitz bath, rest, sedation, antibiotics, analgesics, and sometimes, if it was really bad, you would have to infiltrate the spermatic cord with protein hydrochloride. And I wouldn't want to do it because I wouldn't want to beat along the head and shoulders because it would hurt. But they got that on there sometimes. There's another question that they ask on the exam all the time. What disease is characterized by bloody diarrhea, prostration, abdominal cramping, anorexia, malaise, and fever? And the answer is non-specific ulcerative colitis. And a lot of times on the test, they'll have what condition would you have 30 to 40 bowel movements a day? Non-specific ulcerative colitis. Which of the below is not true concerning diseases of the genitourinary tract? If you massage the person's prostrate, if they had prostatitis, they would probably beat you severely about the head and shoulders. What condition is caused by blockage of one or more of the branches of the coronary artery? And MI. Remember, if a person has angina pectoris, they would have vice-like pain. Remember, if a person has angina pectoris, the drug of choice is nitroglycerin. You would give one tablet every 5 minutes until you use a max of 3 tablets. Which of the below is not true concerning various medical conditions? That's right. Lymphangitis is a lymphadenitis is a lymph vessel, and know the difference. What condition is characterized by pain, tenderness, and sometimes swelling of one or more of the costal cartilages? That's right. TT syndrome, which is also known as the first one. And know that you would treat it with lidocaine and steroids. What type of arthritis usually occurs in large hinge joints? Gonococcal. Know that rheumatoid arthritis usually affects more than one joint, and it's more common in women. Know that degenerative arthritis is more common in the middle age of older people and also more common in women. Gouty arthritis affects the ankles, the toes, and the thumbs. How would you treat an individual who has a small, perforated tympanic membrane? No treatment is indicated. What fungus infection of the external ear results from poor hygiene swimming and favors warm, moist climates? Otomycosis. And you can bet you're going to have otomycosis on your test, or they're going to ask you what is caused by chronic otitis media, allergies, trauma, blood dyscrasia, and cardiovascular disease, and that is Labyrinth's disease. Labyrinth's disease. That'll be on another study guide, but it's spelled Labyrinthine disease. What should be used to remove a pea from the ear? You irrigate it with alcohol or light oil. Remember, if somebody has vegetable origin in the ear, if you use water or saline, it would swell, you'd never get it out. What if a person had an insect in the ear? A bright light. And if the bright light failed, you would use. Or, everybody says, oh my God, I don't believe that. Use kerosene or alcohol and a match. And it'll come out. Now, the book says that use kerosene or alcohol. Let me tell you what happened. I went down to Pensacola in '79, and I had all my study guides and everything, and I talked to the exam writer, and I said, "What do you think of this?" And he looked at it and he said, "Well, I'm leaving it here. I want to look over it good." I said, "All right," so I left there, and he kept it for a couple of weeks and came back and he said, "It's a good training program." He said, "A lot of questions are screwed up, but," I said, "I don't care about that as long as I'm getting the message across, I don't care." So there was one question. It said, what would you use to remove grease from around a wound? And the answer was turpentine. And he put, really? And the old handbook of the hospital corps said to remove grease from around a wound, you would use turpentine. And I said, yeah, really, page whatever of the handbook of the hospital corps. Take a break. And another way you can stop nosebleed is if you pinch the nostrils. I called down Pensacola a bit ago, and I finally got scheduled for hip replacement on the 3rd of October, but I was scheduled for 24 June, and I canceled it so that I could come up here. No, I'm tired. I'm really tired of giving classes and not getting any recognition. So Navy Times is supposed to be here and do an article this week. So at least I'll get a little bit of recognition now. But you'd be surprised down Pensacola. I give classes, 90% of the people get advanced. I go to the procking ceremony, and it's like I'm not even in the state. So, tired of it. They had a CO down there that was totally against me teaching. They had a command master chief the same way. He was on active duty when I was on active duty. He was an E8, and and everything was fine as long as I was on active duty, but when I did this during my own time, then it was wrong. So he even called the exam center and tried to get them to say it was illegal. I mean, I can't believe that senior people would feel that way. There's too many senior people in the Navy that should be doing this stuff that I'm doing, you know? When I was a junior, I had a hell of a time with the exam. I mean, a lot of people don't realize they think it was, you know, the exam to me came easy, but it didn't. I mean, and that's primarily why I started the advancement program. That was primarily why I started the advancement program, because I couldn't do any good on the test, and I wanted to help kids that had the same problem I did, because I could take and I could read a question and I could throw two choices out and I'd narrow it down to two, and 90% of the time I'd pick the wrong one. But people don't realize I took the third class exam 3 times. I failed it, I PNA'd it, I made it. Second class I failed it twice and I made it. First class test I failed it twice, I PNA'd it twice, and then I made it. And then I got involved in training, and when I went up for chief, I took it 4 times before I made it. But Willie, you shouldn't feel so bad now here. I never told you that before, did I, Willie? Huh? But there's too many people with the attitude of, I made mine, you get yours, and that's bull. You know, I don't care if I don't teach you anything other than how to take a test. At least I'm teaching you something, you know. When I was on active duty in Pensacola, I did a lot of work that, you know, that really wasn't required of a master chief, but I wanted to do it and do it right. And every month I used to put out a list of people that were qualified to take the exam the next time, and then I had to put another list out saying who needed what requirements. And I'd give them to the senior enlisted advisors, and they'd kick the people on the ass to get it done. But everybody said, oh, you babying them. I said, babying them how? You know, you need to show these kids what they need to know. I mean, there's too many of them that don't even know what the hell bibliography is, you know? And that's you guys' responsibility, too. You need to take these kids under your wing. You should have been in my retirement. I started talking about the kids, and I lost it. It was over. Okay. What is an inflammation of the thin mucous membrane lining the interior portion of the eyelid and the anterior surface of the eyeball? Conjunctivitis. What a hordeolum? A hordeolum is a sty due to staphylococcus. Know that a dendritic ulcer is a corneal ulcer caused by the herpes simplex virus. Floaters is seeing spots, and that affects older people. No, I don't have floaters. What part of the body is not normally affected by contact dermatitis? The scalp. What condition is found in 2/3 of all adult white males but is really found in blacks? Psoriasis, and that's been on many, many, many tests. Know that acne is the most common dermatitis, and a drug of choice for acne is tetracycline. What should you never take with tetracycline? Milk. Know that urticaria is hives, and it is caused primarily by shellfish, eggs, milk, and penicillin. What condition is very common, contagious, benign epithelial tumor, and may persist as a single lesion or develop satellites? Verruca, that's right. We know that herpes zoster is the same as shingles. And that is a viral infection that's caused by the same virus that causes chickenpox, is rarely recurrent, is most commonly encountered in people over the age of 50. No, I don't have shingles. The fungus infection occurring in the area of the inner thighs is termed tinea corpus. If a person has a fungus infection of the scalp, it is termed tinea capitis. If they have it of the body, corpus. If they have it of the crotch, tinea curis. If they have it of the feet, fetus. If they have it of the nail, ungum. And if they have it of the trunk, it is versicolor. Yes. What's the matter? If they have it in the inner thigh, that's jockey, it's curis. Corpus is body. Capitis is head. Trunk is versicolor. What drug should be given to help prevent cluster headaches becoming vascular headaches? Sansert. They may ask you what is the most widely used drug for migraine, and that is Caprigot. That is also known as ergotamine tartrate. Know that glaucoma is an increase in interocular pressure elevated over 25 millimeters of mercury. Which of the below is not true concerning epilepsy? You wouldn't force the mouth open and insert a tongue depressor to keep the person from biting the tongue. Know that all herniated discs, or the percent of all herniated discs that occur at the fourth or fifth lumbar interspace is 90%. 90% of all herniated discs occur at the fourth or fifth lumbar interspace. What condition is characterized by severe headache, nausea, vomiting, stiffness of the neck, positive Koenig sign, and bilateral Babinski reflex is usually present? Subarachnoid hemorrhage. Remember that a CVA is a stroke, a cerebrovascular accident. Extradural hematoma is bleeding in the extradural space. Subdural hematoma is rupture of a cerebral vein. What conditions characterized by myxophthalmos features such as enlarged tongue, slow deep-toned speech, dry thickened, edematous skin, puffiness of the eyelids, hands, face, and alpacia, which is a loss of hair of the scalp and the eyebrows. Hypothyroidism. And know the difference between that and hyper, because they normally have one or the other on there. Hypothyroidism is increased metabolic rate, and exophthalmos, which is protrusion of the eyeballs, like a chihuahua. What's the most predominant symptom of trichomonas vaginitis? Leukorrhea, which is a waste viscid discharge from the vagina. Know that the type of vaginitis that is a result of an overgrowth of the Candida albicans yeast, and history might reveal a recent period of antibiotic therapy, is Monolia. M-O-N-I-L-I-A. What are you going to use to treat it? Myostatin or Monostat vaginal cream, Monostat 7, or mycostatin tablets for 15 days. Know that if a person has bacterial vaginitis, you should check them for intra and extracellular gram-negative diplococci morphologically resembling Neisseria gonorrhea. What's the drug of choice for trichomonas vaginitis? Flagyl is a drug of choice, but remember that if a person is pregnant, you would not use Flagyl. What condition is present in a lady whose menstrual cycles are absent or more than 6 months apart? Amenorrhea. Know that salpingitis, the person would have a greenish yellow discharge, and that is an inflammation of the uterine tubes. Know that the treatment for salpingitis is 4.8 to 12 million units of aqueous penicillin G. And if they are allergic to penicillin, you would use dibramycin, which is also known as doxycycline. The command responsible for notifying what agency in all cases of sexual assault or rape? NIS. Remember that NIS provides a sexual rape kit. When some tissue has been passed, the remainder of the conceptus remains in the uterus, abortion is incomplete. What is the chief hard tissue of the tooth which surrounds the tooth pulp, is covered by enamel on the crown and by cementum on the root? Dentin. And know that the cervix is the neck of the tooth. The cervix is the neck of the tooth. Also, they may ask you, what is the light yellow substance that makes up the bulk of the tooth? That also is the dentin. What's the most frequent cause of severe dental pain? Acute pulpitis. A lot of times on cavities, they'll ask you, what is the first sign of a cavity? It first appears as a chalky white spot. And know that bacterial plaque is the most common cause of cavities, caries. Know that marginal gingivitis, the most frequent cause, is poor oral hygiene. What infection is usually the result of long continued irritation by food debris? Deep deposits of calculus or foreign objects such as a toothbrush, bristle, or popcorn has been tightly packed between the tooth and the soft tissue. Periodontal abscess. What is the second choice? What is pericorditis? That is inflammation of the third molar, which is a wisdom tooth. And a lot of times they'll have a picture of that tooth on the exam. Know that that appears more frequently in the age group of 18 to 25. Remember that if you are examining anybody's mouth, you should never get into their mouth unless you got gloves on. A patient complains of bleeding after a tooth extraction, weakness from spitting or swallowing large amounts of blood, and they also complaining of blood in the bed clothing. They should be suspected of post-exodontic hemorrhage. Remember that post-exodontic osteitis is when a normal clot fails to form in the socket of a recently extracted tooth. What type of tooth fracture exhibits slight exposure of the pulp? 2. Remember, there's 4 types of tooth fractures. One is a chip. How are you going to treat it? Sandpaper and varnish. 2 is slight pulp exposure. 3 is much pulp exposure. And 4 is fracture of the root, and the only way you can confirm a 4 is X-ray. How many dental classes? 4. 1 is white, 2 is green, 3 is yellow, 4 is red. The only one that can be assigned by Corman is red. And remember, red, class 4 is somebody who hasn't seen a dental officer within the last year, or they lost their dental record. The unknown oral classification because the patient has not received a dental exam for the past 12 months or dental records been lost would be indicated by class 4 red. Another question they ask in dental. Lidocaine, which is also known as xylocaine, is the most common anesthetic used in dentistry. When it is combined with epinephrine to prolong the effect of the anesthetic, what is the max dose? 300 milligrams, that's right. What did I tell you? Or I ain't told you in first day yet because you ain't had that yet. I'll tell you that in a couple minutes. What is NUG in dental? Nug, yeah. Necrotizing ulcer of gingivitis. Remember, if somebody has gingivitis, that is also known as trench mouth. A person would have bleeding gums, redness, swelling, and the gums would bleed on finger pressure. And they would have halitosis. But halitosis is better than no breath at all. Remember that stomatitis is inflammation of the oral mucosa. What's an ABNED 6600/3? That's the Dental Health Questionnaire. What is a standard form 603? That's the dental record. Remember, hypersensitivity entries in the health record go on the standard form 603 dental. It also goes on the outside of the health record jacket in the block indicated. It also goes on the back of the 601, the immunization record in remarks and recommendations. It also goes on an ABNED 6150/20, which is the problem summary record. No longer have a special 600 for hypersensitivity. The 6150/20 replaced that. Today, Phil, could you go up there and get the, the study guide on the diet therapy? How about getting that and give you that tonight so you can fill it out? No, I'm talking about, no, that's the one with, that's a fill-in, the fill-in block. What are the most important nutrient required by man? Protein. And remember that the most efficient source of energy, known as the fuel of life, is carbohydrates. What element assists the normal functioning of the thyroid gland? Iodine. What percent of the body is made up of water? 70% water. What diet is recommended for gastritis, hyperacidity, hemorrhoids, peptic ulcer, and pyrosis? A bland diet. What diet is used in renal disease associated with nitrogen retention or GI disorders when putrefaction is present? Low protein diet. Which of the below is not true concerning diet therapy? An insufficient intake of water causes constipation, not diarrhea. Which of the following vitamins are transported throughout the body in water and are classified as water-soluble? B, C, and folic acid are water-soluble. Remember, fat-soluble vitamins, think of Alaska. ADAK, ADEK. Which of the below is not true concerning the low-sodium diet? Regular diets with no salt added contain 2.4 to 4.5 grams of sodium. Which of the below is not true concerning the low carbohydrate, high protein diet? Sweets should never be given for hypoglycemic reactions. On that one, and on your handout you'll be getting on diet therapy, that is the only one, that's the only condition where you need two diets. The low carbohydrate, high protein is for hypoglycemia, and that is on the exam all the time. There's another one that is on there all the time on diverticulitis and diverticulosis. When you think low, diverticulosis, think high. High residue. Diverticulitis is low residue. But I'll have that pounded in your head by the time you take the test. Do what? What type of diet indicates an atonic constipation, spastic colon, irritable bowel syndrome, and diverticulosis? High residue. Remember, low, you think high. Diverticulitis, low residue. What type of diets indicate what edema is present, renal disease, hypertension, cardiac conditions? Remember, anything to do with the heart is going to be low salt. How many calories does each gram of protein yield in the process of its metabolism? 4. Remember the PFC in the Army or the Marine Corps. PFC is protein, fat, carbohydrate. 4, 9, 4. Okay, first aid. I'm not going to really dwell on this. I'm going to go over it quick because normally on the first class and chief's exam, the only thing they may ask you in first aid would be heat stroke. But I might say something that might be able to make you eliminate a choice or whatever, so I don't like to leave first aid out. What's not a primary consideration of first aid? Proper medical diagnosis. Irreversible brain damage can occur a minimum of how long after breathing has ceased? 4 to 6 minutes. What's a DD-1380? A DD-1380 is a field medical tag used to tag casualties of combat. The Navy ambulance will be stocked in accordance with AvMed Instruction 6700.9. What's the second choice? AvMed Instruction 6440, and that should be .6 is the instruction on MR. And AvMed Instruction 6150.1 is the instruction on the health record. And ViewMed Instruction 6230, and that should be .3, not 1H, is the instruction on immunizations. In a combat situation, those personnel whose injuries require immediate life-sustaining measures or are of a moderate nature, and they require a minimum amount of time, personnel supplies would be placed in what triage class? 2. Remember that 2 and 3 require the highest priority for evacuation. 1 are people who you can get back to work and get your command back on his feet, minor cut, in a combat situation. 4 are people who have no chance of recovery, and they're treated at the battalion aid station. In a non-combat situation, the casualties which generally have minor injuries or have obvious mortal wounds where survival is not expected will be classified as priority 3. Remember, in a non-combat situation, there's only 3 categories. 1 is life-threatening. There's been question, too, sometimes about which one takes priority. Breathing is number 1 and bleeding is number 2. What procedure is highly effective in removing water from the lungs of a drowning victim? Abdominal thrusts, which below is not true concerning the use of the esophageal obtutor airway, EOA. The tracheobronchial tree cannot be adequately suctioned. That's a disadvantage of using it. What type of artificial ventilation is the most effective on the battlefield after chemical or biological attack? High pressure arm liquids is also known as the Holger-Nielsen method. How many a minute? 12. What's the best artificial respiration? Mouth to mouth. How many a minute? 12. And if a person had injury around the mouth, you would use mouth to nose. How many a minute? 12. 1 every 5 seconds or 12 a minute. What type of system was designed to help ventilate an unconscious victim for long periods while delivering high concentrations of oxygen? The bag valve mask, but watch how they might word that. Because the system that has the greatest advantage of providing greater air volume and is easier to use is the mouth and mask. When you apply CPR, you keep the heel of your hand off the xiphoid tip of the sternum because a fraction of the sternum may cause damage to the liver. And how far should the sternum be depressed when given CPR on an adult? 1.5 to 2 inches on a child, 3/4 to 1.5, and on an infant, 1/2 to 3/4. When two people perform CPR, the ratio of compressions of ventilations is 5 to 1. When one person performs, it's 15 to 2. What's the compression rate for children and infants? 80 to 100, adults to 60 to 80. To prevent it, anaerobic infections, primary closure, are not made for what type of wound? A puncture wound. Remember, if a person has an amputation, the only way that you can possibly save it if you wrap the amputated part in a sterile towel or whatever and put it in a cool container. You don't use ice, and you don't use ice water. What is the most common injury seen by a hospital foreman? Soft tissue injury. Which of the below is not a true statement concerning hemorrhage? That's right, the loss of 1/2 liter is normally the amount that's given by a blood donor. That is 1 pint. What type of wound is made by a blunt rather than a sharp object and you have jagged edges? A laceration. The spiral reverse bandage be used to retain a dressing on the leg. Know that if you use a roller bandage, you should start at the smallest circumference and you should end where you started. What bandage is particularly useful in retaining large compresses of the foot? Triangle bandage. The cravat bandage for the temple, cheek, or ear is also known as the modified Barton. If they ask you what bandage used for a fractured jaw, you would say Barton, modified Barton, or a four-tailed binder. Fractured clavicle is figure of 8. Bandage for a fractured rib is a Swaz bandage. What pressure points should be used only if it's absolutely essential? The carotid, how many pressure points on each side? 11 they are. Temporal. Facial is used to control bleeding below the region of the eyes. Carotid only used if it's absolutely essential. Subclavian, brachial, radial, iliac, femoral, behind the knee, popliteal in the ankle, the anterior and posterior tibia and fibula. If they ask you in lab what vein is used for vein puncture, what are you going to put? Don't you even say brachial. The subphilic or the basilic. Don't say antecubital either, because that's used for IV injections in the hand. The great saphenous is IV injections in the foot. But when you draw blood, you use the subphilic or the basilic. What's the term used to describe the excretion of dark black stools? Tarry black stools. Melena. How about bright red blood from the rectum? Hematochezia. When you think bright red from the rectum, you should think of what? Drug. What drug turns stools bright red? Povan. And Povan is an anthelmintic. That's a drug that's used to kill or expel intestinal worms. Know that a vermicide kills worms and a vermifuse causes their expulsion. What's epistaxis? Nosebleed. What is hemoptysis? Coughing up blood. Hematemesis is vomiting up blood. Vertigo. Dizziness, syncope. Fainting, which is the first sign of what? Neurogenic shock. What type of shock is most frequently encountered by hospital coroner battalion aid stations? No, not anaphylactic. Ologenic, also known as. Hemorrhagic, also known as. Hypovolemic. Wound shock. The principal aerobic bacteria that cause infection, inflammation, and septicemia are staph and strep, which are introduced into the wound at all of them. The principal symptom of inflammation include all below except paleness and pus. What is the difference between a furuncle and a carbuncle? That's right, a furuncle is singular. A carbuncle is a group of furuncles. Know the difference between anaerobic and aerobic bacteria. Aerobic live in the presence of oxygen. Anaerobic live in the absence of oxygen. Which of the below is not true concerning furuncles and carbuncles? If a person has an abscess in this area, in the dangerous triangle, you should not incise because of the cosmetic effect and also because of the possibility of spreading infection to the brain. Along the same lines, in dental, if a person has an abscess inside the mouth, you would never apply heat to the outside of the face because it would draw it through. That's on there all the time. You would have them rinse their mouth out with hot water, but you would never apply heat to the outside of the face. What should not be used on an abdominal wound with protrusion of the intestines? Vaseline gauze. Remember, your primary concern if a person has a abdominal wound with protrusion of the intestines is to keep it moist. You could use water saline or even seawater, and you would not take a leak on it. And let me tell you what, don't laugh, they used to do it. But you had a lot of peritonitis. They thought the primary thing was to keep the thing moist. But you don't do that. But you could use seawater, even though it's got salt in it. But you wouldn't use Vaseline gauze because it would stick to it. When you pulled it off, you'd be pulling the intestines out. What's your primary concern if a person has a sucking chest wound? Seal it. A good thing to seal it with is an ID. And remember positioning. If you're in a combat situation, you would place the person on the affected side. If you were not in a combat situation, you would place the person in the Fowler's or semi-Fowler's position. Which of the below is not true concerning wound closure? Delayed primary closure is performed at the end of the 3rd or 4th day, not the 10th. What type of suture needle may cause small amounts of tissue damage and are most often used in deep tissues? Taper point. Which of the following suture material is absorbable? Catgut and chromic catgut is absorbable. What's the difference between catgut and chromic catgut? Chromic catgut takes longer to absorb. It's delayed in absorption. If you suture somebody, how far should the sutures be apart? 1/8 of an inch, unless you suture the face, then they're closer together. How long should the ties be on the suture? 1/4 of an inch, preferably 1/16. Sutures in the face. I better not get ahead of myself. Which of the below suture material has the smallest diameter? 6/0 has the smallest diameter. All sutures and soles, palms, back, or over joints should be removed in 10 days. If stitches are in the face, you're going to take every other stitch out after 3 days, and all of them will be completely removed within 5 days. Body and scalp sutures remain in place for 7 days, and sutures over palms or joints are 10 days, and wire sutures are 10 to 14 days. If you suture and you use xylocaine what is the max amount that can be used? Remember, in dental, it's 300 milligrams, right? When you're suturing, it is 50 cc's of a 1% solution, max. What type of shock is due to a diminished total blood volume? That's hypovolemic, that's wound shock, also known as oligemic, also known as hemorrhagic. What type of shock carries a poor prognosis, must always be treated under the direct supervision of a doctor? Septic shock, but that's a bad question too, because you know damn well right, if somebody had anaphylactic shock, he would be treated under the supervision of a doctor. Which of the below is not a symptom of shock? The skin is hot and dry. When you think of skin that is hot and dry, you should think of what? Heat stroke. Know that the symptoms for heat stroke are completely opposite. Heat exhaustion, which also resembles shock. Heat stroke, the temperature is hypothermic, 105 to 109. Heat exhaustion shock, the temperature is either normal or subnormal. Heat stroke, the face is hot, red, and dry. The person is not sweating. Heat exhaustion shock, the face is cold and clammy. The person is sweating a lot. Heat stroke, the pupils are constricted. Heat exhaustion shock, pupils are dilated. Heat stroke, the pulse is full and bounding. Any place you got a pressure point, you're going to see it pounding out. Heat exhaustion shock, it's weak and rapid, very easily lost. Completely opposite. What's your primary concern if a person has heat stroke? Get the body temperature down. Put them in an ice water bath. Wrap them in sheets that's been soaked in ice water. Put ice under their arm and their groin, but get the temperature down. You can take them out of the ice water bath when the rectal temperature reaches 102. You check their temperature every 10 minutes. And if it went back over 103, you'd place them back in the ice water bath. How many questions did I answer? What's probably the best electrolyte solution to use to replace body fluids? Ringer's lactate. What degree of shock is indicated in an individual with a thready pulse, 100 to 120, systolic blood pressure, 90 to 100, marked vasoconstriction, anxiety, restlessness, and a decreased urinary output. 25 to 35% decreased blood volume, which is moderate. Which of below is not true concerning the administration of morphine? Morphine should never be given to somebody who is walking wounded, always a stretcher case. Remember, if somebody has a head injury or anything that may affect respiration, you should never give morphine. Never give it if a person has fewer than 16 respirations a minute. What's the adult dose? 8 to 16 milligrams, which is 1/6 to 1/4 grain. No more than 1/4 grain may be given in a 4-hour period. What's the max that can be given in 24 hours? 2 syrettes, 1/2 grain or 32 milligrams. Which of the below is not true concerning medical anti-shock trousers, masks? That's right, it's not contradicted in their use for fracture of the pelvis and lower extremities. That's what it's primarily used for. What's the proper procedure for splinting or fracture the upper arm? All of them are right. The Thomas half ring or hair splint may be used to splint a fractured fib or femur. Both B and C. Remember, when you splint from joint to joint. Remember, when you splint a hand, you would splint it in the position of function. What's the best method for mobilizing a fractured rib? Swab bandage. Which of the below is not true concerning the treatment of a fractured jaw? You would ensure that the bandage pulled the jaw forward, not back. If the casualty is unable to move his fingers, he'd probably be suffering from a fracture of the cervical spine. If he's unable to move his legs, thoracic spine. A patient with what type fracture is unable to sit or stand and complains of feeling as though he's coming apart? Pelvis. If a patient reported to sick bay with their shoulder drooping inward and forward, suspect a fractured clavicle. And if one leg was shorter than the other one, a fractured femur. A corpsman shouldn't attempt to reduce the dislocation. Medical aid can be reached in 8 hours. What type of injury involves a momentary dislocation with a bone slipping back in place of its own accord? A sprain. Remember, a strain is caused by overstretching or tearing of a muscle or tendon. If a person has a strain or a sprain, you would apply heat or ice for how long? 24 to 48 hours, and then you would apply heat. What's the priority for obtaining information on a poison victim? First, you would identify the poison. Second, determine how much they took. Third, the time they took it, and then the symptoms, medical history. When you think of poisons, where's the antidote locker located on a small ship? Outside sick bay, where's it located on a large ship? In the emergency treatment room, because you got a corpsman aboard 24 hours a day. Remember, the antidote locker is secure with a wire seal. Anytime the seal is broken, you got to do an inventory. It will contain the minimum antidotes that's listed in what publication? The NABMP 5095, which is poisons, overdoses, and antidotes. And there will be a list by shelf of everything that's in the antidote locker. What book is also in there? The Handbook of Poisons. And then there's a book that's hanging outside the locker, and that is entitled Clinical Toxicology of Commercial Products. What are 4 emetics that are in the antidote locker? Don't say activated charcoal. Everybody says activated charcoal. Activated charcoal is an absorbent. 4 emetics in the antidote locker are ipecac, salt, soap, and mustard. Well, there's Baldo. What's up, Baldo? What is not recommended, or which of the agents listed below is classified as a corrosive poison? Phenol. What's not recommended treatment of non-corrosive poison? Gastric lavage. What is the most common inhalation poisoning? Carbon monoxide is the most common inhalation poisoning. The treatment of acid corrosive poisoning include all below except you don't use bicarb soda because you may cause gas and you may cause the stomach to blow out. Know that if a person accidentally took turpentine, you would give them 1 to 2 ounces of vegetable oil orally. Know that the primary damage from a person that took an alkaloid is to the esophagus. The diagnosis of what poison is made from the circumstances of exposure and the appearance of a cherry red coloration of the skin and the mucous membranes. Carbon monoxide poisoning. With vomiting is not induced, and what type of poisoning due to danger of the additional poisoning entering the lungs? Petroleum distillates, gasoline, kerosene. Which of the below listed fish would be considered safe to eat? None of them. They're all listed in the 3 and 2 as being poisonous. There are some that are delicacies during certain times of the year, but in certain times of the year they're poisonous too. The treatment of a bee wasp for a fire ant sting include all the below except you would not pull out the stinger. If a person is stung by a bee wasp for a fire ant, they got the stinger in there. If you pull it out, there's venom inside the stinger. If you pull it out, it's going to inject it as you're pulling it out. So you take a dull knife and you scrape it off. The violin-shaped markings is characteristic in the identification of a brown recluse spider. How do you recognize a female black widow spider? Hourglass on the ventricles of the stomach. A person bitten by a female black widow spider will have symptoms pertaining to what region? The stomach. And they must be hospitalized if they are under 16 or over. 65. What poisonous snake of the Crotalidate family is also called a pit viper because of the small deep pits between the nostrils and the eyes? A water moccasin, a copperhead, and a rattlesnake are all pit vipers, Crotalidate family. What's the predominant symptom? Pain, because you got blood and swelling in the area. Whereas, if a person's bitten by a neurotoxic snake, which is of the Elapidate family, they're not going to feel that much pain because the nerve endings are involved. The Elapidate snake in the United States is the coral snake. The Elapidate snakes outside the United States is the crate, the cobra, and the mamba. What snake is in a family all by itself? The sea snake is of the family Hydrophilidae. What type venom? Neurotoxic venom. What snake is only found in Africa? The mamba. How long should suction be applied after an incision is made for a snake bite? 30 minutes. The book says, if you can't get the person to anti-venom or anti-venom to them within 30 minutes, you would cut. Make one cut over each fang, mark how deep. 1/4 inch deep, how long? 1/2 inch long, parallel to the longitudinal line of the extremity. Suction should be applied for 30 minutes. See you tomorrow.